Hello there, thanks for listening. Today we're talking to Dr. Isadora Garcia in the dental school about using 3D printing to solve a clinical simulation challenge. Dr. Garcia was a recipient of a LEAPS Educational Innovation Seed Grant in 2025, and this is an update on her progress. I thought we could start by having you tell us a little bit about yourself. How did you come to be a dental educator?
So I completed the DDS, so the dentistry course in Brazil. And after I completed this course, I did my master's, the PhD, and the postdoc, also in Brazil. But part of my PhD was here in the University of Maryland, Baltimore, from 2018 to 2020. And when I finished the PhD in 2022, we had a position open in the division of operative dentistry here in the School of Dentistry. And I applied to be a faculty in that year. So I was already doing the postdoc when I was selected for the interview process and for the faculty position here. And then I came from Brazil to the USA in 2023 to be a faculty here. But since when I was a dental student, I already knew that I wanted to be a professor and a researcher. I was just figuring it out where I would go after the PhD, but I already knew that I wanted to be a faculty.
So teaching was always part of the plan.
Yes, teaching was always part of my plan.
That's awesome. Well, why don't you tell me a little bit about your teaching? What courses do you teach, and tell us a little bit about your students?
So I am a professor in the division of cardiology and operative dentistry in the Department of Comprehensive Dentistry in the School of Dentistry here in the University of Maryland. And I teach the pre-doc students from the first to the last year. So I am with them in the simulation lab of operative ergonomics, dental anatomy, and then I am the course director in the second year in operative, but I am also with them in the third and fourth year for some lectures and for the clinics. So it's very nice because I can see them from the first week in the dental school until their graduation. And I am with them literally from the simulation lab to the last day of clinics. So it's very nice to see their path.
Yeah, so in addition to knowing those students very well, you must have a really good sense of where students are struggling at different points along the curriculum. Is that accurate?
Yes, 100%. I think that I am a faculty here for 3 years already, and in this short time, I could already observe like what they struggle sometimes in the clinic that we could, for instance, do during the simulation labs to make their life easier and a better treatment for the patients later in the clinic. So yes, I can see how they go over time.
Yeah, that perspective must really help as you think about those educational interventions.
Yes, and we can modify lectures in the first years is to make this content appropriate exactly for what they struggle later in the clinic. So it's very nice to have the opportunity of observing them over time. This for sure. I think it makes a lot of difference compared to just being able to see them at the end. You know what I mean?
Yeah. And it seems to me that this perspective is what prompted you to apply for one of the LEAPS seed grants. So do you want to tell us a little bit about the educational need that you were noticing and what you were hoping to do to address it?
Yes, this was exactly the reason why we applied for this grant opportunity. So the main educational need came from a very common gap that we see in dental education. That is the fact that students are trained using highly idealized plastic teeth, but they are then expected to treat real patients with very complex and progressive caries lesions. So here sometimes we call cavities, right? So I'm going to talk here about caries lesion, talking about these cavities. So in preclinical training or in the simulation labs, as we call, most models that we use, they represent caries as a single or very static defect in the tooth, and they do not reflect how caries actually progress through enamel and dentin, nor do they provide realistic tactile feedback during excavation, so when the students are removing this tissue that had caries. So as a result, students often struggle when they transition to the clinic, especially with caries detection, clinical decision-making, and determining how much infected tissue should be removed. So we realized that students were technically learning procedures, but not truly developing so well this clinical judgment, particularly when it comes to the critical question of where should I stop when I am drilling or removing this tissue that has caries. So this highlighted a clear need for teaching tools that can simulate different stages of caries progression and better mimic the feel and behavior of real tooth structure. So this project was created to address this gap by providing multi-stage caries models that help students practice diagnosis, treatment planning, and the caries removal in a way that is closer to a real clinical condition. So the goal is to better prepare the students for patient care and to increase their confidence before they enter the clinic.
That's so interesting. So it sounds as though, I think sometimes in sports analogies, it sounds as though the equipment that you're using in the practice round while the students are in simulation is not going to give them the same sensations or the same, like you said, the tactile experience as what they're going to be using in the game, which would be the actual patient. Was that the challenge? So that the feel becomes very different when they're interacting with the patient.
Exactly. So nowadays, we have a different dentistry. So we work with minimally invasive dentistry. And when we have a very deep lesion of caries, we do not remove anymore the entire, of course, we have many whys and how to do that, but basically talking, we do not remove all the caries tissue that is very deep, like over the pulp, we call. So we leave a specific type of dental hard tissue that has caries on the bottom of this cavity to help protect a little bit more this tooth. However, when the students are learning and doing that in the simulation lab, they have an entire body of caries that is exactly the same. And in the clinic, we remove a very, very soft dentin, and we keep in the bottom a part of dentin that is a little bit more firm. And this little bit, like where should I stop? This is very difficult for them to understand up to where they should go. So we wanted to make the simulation lab even closer to the clinic.
So tell us about what you did. What was your idea to help solve this challenge?
Yeah, so we created this project, so we called it Simu Caries, and this is the idea basically, or how we also use the funds with this grant. We purchased a dual extrusion filaments 3D printer, and this printer allows us to extrude up to 2 filaments simultaneously and to combine up to 9 different filaments or 9 different polymers within a single printed model. So this ability was essential for our project because it allows us to simulate the different layers of the tooth and the many different stages of caries progression within the same tooth. So these materials allowed us to create and test early prototypes needed to produce the initial caries models. And I think basically is we bought a 3D printer that we can use different polymers at the same time to create this difference in caries tissue inside one single tooth.
Yeah, that's amazing. So how is it going? Have you been able to actually create one of these models? Have you figured out the right kind of polymers? Where are you in the process?
So the project is progressing well, and we are currently in the phase of developing the ideal model. So creating different textures using all these filaments base for the 3D printing is a little bit more complex than it might seem because it requires not only changing the type of polymer, but also adjusting the printing parameters, especially the printing speed and the temperature, because this is going to increase the porosity of this polymer and is going to decrease the density of some specific layers. So imagine that one lesion of caries, we want to create at least three different tactile sensations. So we need to change the velocity and the temperature that the filament is being used for us to have these different of textures. So it's a little bit tricky, but it's going well. We are creating the final model now. And I think this process has taken longer than we initially expected, but it has been extremely interesting and rewarding. We are already producing teeth with clearly different tactile perceptions, which is exactly what we were aiming at the beginning. And another very positive aspect of the project has been the student involvement. So two third-year dental students began working with me on this project last year, and one of them presented the project at the American Association of Women Dentists meeting last year. And it was very nice. The idea was very well received by the professors of other institutions. It generated a lot of good conversation. And both students are enrolled now in an elective course called Research with a Mentor at the dental school with me. And they have been very, very important to help me with all these tests and 3D printing and model development.
That is so exciting. So you have students serving with you as kind of co-investigators. It sounds like a very experimental process, trying different ratios, different printing speeds. It sounds like a lot of trial and error to get this exactly the way you want.
Yeah, we bought some different filaments because we talked with the manufacturers and they explained to us what would be the hardness and what to expect about porosity of each one of them. But even having different filaments, different polymers from the beginning, we also need to do all these small changes in the speed and in the temperature that these filaments are being printed. So it's very like test, okay, didn't work, go again, change a little bit. So the students are helping a lot to do these small and very important modifications.
Yeah. Oh, that's exciting. Do you have a sense of when you might be able to have students working with these models?
Yes, we believe that in the class that is going to start in August, we are going to have already different teeth with different perceptions, like tactile perceptions. And we are going to have already one single tooth with all these different layers. So they are going to be able to remove, for instance, the first layer of caries and see, wow, this is very, very soft. And then they go deeper, deeper, deeper. It's going to start to be a little bit firmer. So they're going to have all this difference in one single tooth. Probably all of this is going to be able to have in August for the next class.
I can't wait to hear how it goes. And I'm also curious what your vision is now that you're close to having this prototype, you're close to having students working with it as kind of the pilot group. Where would you like to see this go?
So the next step will be to formally assess the students' tactile perception when working with these different models. And we plan to apply a survey and structured evaluations to understand how students perceive the different textures when using different dental instruments. Specifically, a spoon excavator, which is a manual instrument that we use in the clinic, and a bird, which is a mechanical or a rotary instrument. So you can work with both, and we want to evaluate how the students are going to feel using these both instruments in these models. And after that stage, we will begin to further combine and do all these different layers with different textures within the same cavity. So all of these we expect to do with this class that's going to start in August. So we will likely start with two distinct textures in a single lesion, but then progressively add more layers with more different tactile properties to better represent the clinical reality of caries progression. But what has been most interesting to me now, I think, is not only the goal of creating the tooth that looks and feels as close as possible to a real caries tooth, but also the educational impact of exposing students to these layered models early in the training. When the students repeatedly work with teeth that have these different layers and tactile responses, I believe that they are going to gradually internalize the concept of minimally invasive dentistry, and they're going to start to place greater value to on tissue or dental hard tissue preservation. And this is something that we really want to achieve in dentistry in the entire planet along the time.
Yeah. So it makes that concept much more real early on in their training.
Exactly.
And that sounds like that's meeting the goals of the field in terms of patient outcomes and patient experience. So this is just an incredible project, Isadora. I'm so glad you shared it with us today.
My pleasure. I really believe that maybe this can have a meaningful long-term, impact on their clinical decision-making, for instance, like encouraging selective caries removal instead of complete caries removal in deep lesions, which nowadays we know that it leads to better outcomes for patients. So
yeah. Oh gosh, I bet other schools are going to be interested in this as well. And I can't wait to hear how this evolves over time. Congratulations.
thank you so much for the opportunity.